And hello everyone, let's continue our discussion. We've talked about the upper respiratory tract. That's everything from the mouth and the nose in down through the pharynx, the larynx, the epiglottis area, and now we need to continue and talk about the rest of the respiratory tract, the path that air takes into your body. And the lower respiratory tract continues from where the upper respiratory tract stops. So it stopped at the larynx, so it continues with the trachea, tube down your throat, the bronchi, which are the larger tubes in your lungs, and then the bronchioles, the tiniest, smallest tubes in your lungs that lead finally into little air sacs called the alveoli. So let's jump into this. So the trachea first, also called your windpipe. It's a flexible tube. It connects the larynx to the bronchi, and its job is to draw air, to permit a passageway for air down your throat. It's got all of these little bands of cartilage. You can see them here, and you can actually feel them if you feel the front of your throat. Larynx there at the top where your Adam's apple is, but you can actually feel those bands of cartilage. Those bands of cartilage help to hold open that tube, hold open the trachea or the windpipe. Inside of the trachea, there are cilia. Of course, cilia are through the whole respiratory tract, and those cilia beat to pull things out of your respiratory tract, to keep them out of your lungs and to get them out of the lungs if things do get in there. You can see here the cilia with some little green, and this has been artificially colorized, some little green things that are stuck in there. Perhaps it's a bacteria or a piece of dust, who knows what that is, but that cilia is there to help to clean, as we talked about earlier. After that trachea that comes down, that trachea splits and it enters each lung. Once that trachea splits, it's no longer called the trachea, it's called the bronchi. Bronchi are these tubes all together, and they split from your primary bronchi, these first two, into secondary bronchi off of that, and then tertiary off of that. It gets smaller and smaller and smaller. And altogether, it's bronchi altogether, bronchus singular, just one tube. And that allows the air to continue to travel into the lungs. The construction of those are much the same as the trachea, they're just smaller. And so finally those bronchi, they divide, they get smaller and smaller into bronchioles, the smallest tubes that enter the air sacs, the alveoli. Those bronchioles are so small, they're microscopic by the time you get down to the smallest ends that end in these 300 million alveoli that we've talked about, these little tiny microscopic air sacs that you can't see without the aid of a microscope. And it's often been said that this pathway for air kind of looks like an upside down tree. Here's the trunk, the trachea, and then the major branches are the bronchi, and then they divide to smaller branches and finally end up in the smallest branches, the bronchioles, and then perhaps the alveoli are the leaves that are on that tree. So here's the bronchioles, the smallest tubes that end in these air sacs. They lead into the alveoli. Here's a bronchiole. You see it's been cut open so you can see inside the little tiny holes that it has that lead into the air sacs. So let's talk about the lungs here for a moment. These tubes from the bronchi on lead into the lungs. The lungs are kind of shaped like a cone. They are not the same size. The left lung is bigger than the right lung because the right lung is bigger than the left lung because on the left side you have to make room for your heart. And these lungs are where the gas exchange actually occurs. Lungs are elastic. Every time you inhale, they expand, and then when you exhale, they contract back. Lung tissue is very susceptible to injury, so we have to do our best to try to protect it. And lung tissue, of course, is where the alveoli are, and this is where gas exchange occurs. The top of the lung, the top of the cone, if you will, is called the apex. It's the superior portion. The base, or the inferior portion, you notice it's kind of dome-shaped. It's on both sides. And the diaphragm is right underneath of the lungs here, that muscle that helps you to breathe. Each lung is divided into lobes, or major pieces. That right lung that's bigger has 3 major lobes. The left lung only has 2 major pieces. And finally, you get these alveoli, these little air sacs. Some people have said they look like little clusters of grapes. and the bronchiole brings that air into the alveoli. The alveoli are small elastic sacs. Their walls are very, very, very thin, and they're surrounded by blood vessels. When you get to those alveoli, oxygen leaves the alveoli, leaves the airway, goes into the blood. Carbon dioxide leaves the blood and gets into the alveoli, into the airway. This is called respiration, the exchange of gases, carbon dioxide and oxygen. The exchange of those two is called respiration. And this first example of respiration is called external respiration, because air, you can think of it this way, is coming in from the external, leaving the alveoli, getting into the blood, coming in from the external, from outside your body, through that the upper and the lower respiratory tract. So here's another way of looking at the alveoli and the blood vessels around them. You notice blood vessels, they're blue. They're bringing in, first the blood is blue. It's actually dark red, but we think of it as blue. And that blue blood is low in oxygen, high in carbon dioxide, and then the red blood is high in oxygen, low in carbon dioxide, because this gas exchange has occurred. Air has left the alveolus, that's one alveoli. Oxygen has left the alveolus, gone into the blood. Carbon dioxide has done the opposite. This is that external respiration, that exchange of gas, respiration, has occurred at these alveoli. And this happens very, very quickly, because think, when you inhale, how long do you leave that air in there? Just for a second or so, and then you exhale again. So this gas exchange has to occur very, very quickly. It occurs by diffusion. Diffusion simply means that things go from low to, I had it right the first time, from high to low concentration. Oxygen goes from high concentration in the alveoli to lower concentration in the blood. Carbon dioxide goes from high concentration in the blood to lower concentration in the alveoli. And we will stop on that. That is the lower respiratory tract. If we went from here, it is the trachea, the bronchus or pleural bronchi, the bronchioles, and the alveoli, and the lung that they're all in, the lungs, I should say. We'll talk more next time.